Welcome. Today we are going to focus on our knees. We're going to do a little bit of soft tissue work. We're going to try to loosen up some of the musculature around our knee that might be affecting it if it's too tight. We're going to do a quick assessment looking at our hamstrings. We're going to stretch out the tissue that, again, could be tight and that could be affecting the area. And yeah, just a nice slow start to the day, maybe finishing the day if you've worked all day. The first thing we're going to do is we're going to set a timer for 30 seconds. I'm going to take care of that for us. And we're going to be sitting on the floor with our leg out in front of us. You can be on the couch, you can be in bed, you can really do this anywhere. But all I want us to do is rub around our knee with our fingers, trying to search for tissue that's tight, painful, sensitive. Maybe you feel like there's inflammation on one side of your knee and maybe not on the other. Again, this is just kind of an exploratory concept of, feeling around and just seeing what we come back with as far as information. Again, right below my knee, it's a little tender, so I kind of rub in there a little. Again, this is going to be great for moving out inflammation. There's our 30. Switch sides. Let me get this leg out of the way. Going to be great for, again, getting rid of inflammation in the area, promoting blood flow, increasing the fluid dynamics. Our knee is a simple joint. It's a hinge joint. And a lot of the time, unless we've hurt our knee, doing some lateral quick movement in athletics or how we step or hyperextending our leg, outside of those, if we get chronic knee pain, generally, it's from our hip or our ankle, more complex joints, not functioning correctly, and there being an imbalance, and that asymmetry causes wear and tear on our knee. Good, that's 30 there. Next up, what we're going to focus on is we are now going to massage the tissue of our quad. So we're going to go back to the first leg. We're going to start massaging out this quad. Again, I'm being a little rough with my leg. I'm trying to explore again to find tissue that's tender and painful. That's the most important part of this, at least, to learn. Are we overactive in certain parts of our leg? Do I need to use a lacrosse ball, or do I need to use a foam roller to loosen up some of this tissue? A few more seconds here. Again, if we have tight tissue, it's like a dried sponge. I love that analogy. And the tissue is more likely to tear. It's not going to fire properly. So again, doing massage therapy and myofascial release is going to help you hydrate the tissue, more so than it's going to loosen the tissue. That's kind of where the stretching and the lengthening comes in. This, again, is just going to help the fascia and help promote some blood flow and, again, hydrate the tissue over time. Okay, so we got another 30 seconds here feeling around. Loosening this up. Again, we are going to stretch this in a bit, so that's going to be an important component. Okay, next, we're going to go over hamstring mobility. A lot of people who get knee pain, it's part of that is a byproduct of having tight hamstrings and the relationship between your quad and your hamstring. It's either too tight of a quad, too weak of a hamstring, or too tight of a hamstring, too weak of a quad. That push and pull relationship goes on within your knee, because when you flex your knee, one has to contract, one has to lengthen. Anyway, we're going to do a hamstring stretch here. So laying down face up, the first thing I want you to do is check your hamstring mobility. Can you take one leg, keep it locked out, and bring it all the way up to 90 degrees straight? If you bend your knee, or if it just doesn't look like this, we're going to need to stretch out our hamstring, and that's what we're going to do now. So I'm going to set a timer for 30 seconds again. My TheraBand is around my foot. I pull my foot all the way back, making sure it's locked out. Straighten it, and now we're just going to sit here taking deep breaths. 30 seconds. Maybe every time you breathe out, you pull it 1/4 inch further back. Breathe in, try to relax, deep breath out, pull it a little further back. If you want to make this more of a calf stretch, pull toward your toes and pull your calf down into dorsiflexion. You'll stretch your calf out. Okay, 30 seconds there, done. Next 30 seconds, reset. Again, feel around, play around. Do you have one side that's tighter than the other side? Do you notice your foot rotating in your ankle? That'll tell you about your lower extremities and the tightness in your calf and your hamstring. You might try to alleviate by rotating. Again, this is just a really simple, slow routine to bring us some awareness of our knees and our lower body health. And it's just a good habit starter. And this is super quick. This whole thing's going to take us less than 7 minutes. Okay, Last thing, guys, we're now gonna do a quad stretch. I want you to turn onto your side. You're gonna take your TheraBand. It's gonna go on the top leg, okay? I am then gonna take the, wait, hold on now. Nope, I got it wrong. It's the bottom leg. I messed up. Okay, we're gonna take the bottom leg. The top leg comes over top. Bottom leg is behind us. I have the TheraBand here. If you're mobile enough, you can just grab your foot. If you're not, you have the TheraBand here, and you're just gonna pull your foot to your butt, and you're gonna feel a big stretch in your quad. If this isn't a good stretch, you can move your knee back further and get into more hip extension, and then it'll intensify the stretch. So again, knee close to your body here, not so much. Further back behind you, bigger stretch. We're gonna hold this for 30 seconds. I'm sorry, this definitely is not the most flattering view, but that's why I'm gonna edit it and I'm gonna give you a better view right now. Deep breaths. Keep pulling that foot to your butt. Again, we stretch our quad by going into knee flexion, pulling our foot to our butt. Okay, let's switch sides. Restart this puppy. And this is it, almost done. Okay, pull that foot up to my butt. Deep breaths. Again, every breath you take out, you breathe out, maybe you move the knee back a little more and go into knee flexion. But I appreciate you guys for being here today with me. I hope this was a little helpful. I hope we got to learn a little bit about our knees and at least start the day with a good habit, or maybe finish the day before you go to bed. It's so important we think of these little things. Make sure we move well, because this stuff is going to really matter as we get older. We need to move well and make sure that all of our joints have adequate range of motion and stability and strength. And that's it. So thanks for joining me, guys. I appreciate you being here. I look forward to seeing the progress in the future. Let me know how you did today and what was tight and how it felt. And I'll see you soon. Be good.